Time for some NGN practice. Let's do a highlight table. So you're reviewing data on someone prescribed lithium. You've got this chart, you see all of their lab data, and basically you've just got to click with anything that requires follow-up. So on these highlight tables, when you use your mouse and scroll over, it's basically going to light up anywhere that you can click. Anything that requires follow-up, you click it to highlight it. That's that. I recommend that you treat these highlight tables like a series of multiple choice questions. Just look at each cell and ask yourself, hey, true or false, does this require follow-up? If it does, highlight it. If not, move on. So let's look at the first one, white blood cells. You can see they're slightly elevated, but am I going to follow up on a white blood cell count that's just 500 over normal? Not really. So don't highlight it, move on to the next. Next question, should we follow up on a sodium level of 130? It's just slightly below that normal range that we see, but remember that lithium is a salt. And if we've got an abnormal sodium range, that can drive lithium toxicity. So I actually do want to follow up on this. Highlight it. Now let's look at that potassium. We see 3.7, it's right within the normal reference range. No need to follow up, don't highlight it. On to the next question. Looking at our BUN, it's 29. That's significantly above the normal reference range. It's telling us the client's dehydrated. And we know that's a problem with lithium. Again, lithium's a salt. Our client's getting dehydrated, concentrated. That can drive that lithium level up, and we know that that's a problem, right? It has a narrow therapeutic index. So we need to follow up on that BUN. You guessed it. Highlight that BUN. Absolutely. Now let's look at the creatinine value. It's within normal range. Not needed to follow up. Move on to your next value. Lastly, we have lithium. 1.5, that's a toxic level, kind of what we would have expected given our other lab values. So of course, you're going to follow up. After highlighting lithium, you've completed your table. It was basically 6 true or false questions. You looked at each lab value. If it was abnormal, you highlighted it to follow up. And if it was normal, you moved right along. You can do this, Archer nurses.